What's up, MOMnation, and welcome back to another episode of Live and Learn. I am excited about this one. I say that all the time because I love interviewing our mama members, especially those that have such amazing expertise, just like the mama member that I have with me today. Hello, Dr. Bobbie. How's it going?
Hello, I'm doing great. How are you?
Awesome. So good to have you here. Thank you for spending a little bit of time with us today.
Absolutely. I'm so excited to be here.
I am excited to have you because I've got questions, girlfriend. So today we are talking about prenatal chiropractic care. And this is a topic that I feel like we don't talk enough about. When I was pregnant, it was not, this was before I knew you, doc. So it was something that I was not properly educated on. So I'm so grateful to have you here to help out our mamas, to give them a little piece of education in terms of prenatal chiropractic care. Can you just give us a brief synopsis of who you are and what you do?
Of course, yes. So again, my name is Dr. Bobbie Bennett, and I have a chiropractic practice in Tempe. And one of my focuses has been, since the start of my career back in 2006, has been the prenatal population. And it's just so much fun to help these mamas not only feel good during their pregnancy, but also just to help to prepare them for the changes their body's going to be going through, what to expect when it comes time to have baby, and then what it looks like postpartum and how I can help to assist them and just help them to feel better.
Yeah, and we all know that pregnant mamas need all the help they can get to feel better. We're dealing with so much. Our bodies are changing rapidly. So much is going on. So let's dive right into it. Now, if again, when I was pregnant, so this is, over 10 years ago now, I only have the one. So, I just have him as far as experience. If I was talking to you right now, pregnant with my one, I would have some concerns about chiropractic care because when I go in, and it's amazing when I go in and see you, right? I feel so much better when I come out, but I would be concerned about having a baby in there and doing all that cracking and popping and moving around. Can you shed some light on that and tell me why that is not a concern?
Absolutely. Well, number one, there are some really great training programs out there. So, when we go through school, chiropractic school, they teach us, a little bit about prenatal care. It's talked about, with the anatomy and kind of modifications. But what you really want to find is somebody who's gone over and beyond and taken extra classes post graduation that actually are, very specific on treating pregnant women, because there are some modifications that we do. Everything's, every body is not the same, but the force that's used during prenatal care, chiropractic, is very different than what you would traditionally see from a chiropractic visit. We know exactly the areas that we can work on safely. We know the areas that we need to avoid in the body. There are some acupuncture points and acupressure points that that we're taught to avoid. And so we have special pillows. You put it down on the table so the belly is really nice and protected. All the fluid goes to the front of the belly. So when mom's laying face down, even the day that I've had moms lay on the table 40 plus weeks and they're comfortable because we stack up the pillows, their belly has nice protection, but there's no pressure being placed on that area. So we can safely assess how their pelvis is moving, how the rest of their spine is moving, and deliver some really specific and gentle adjustments to help them to feel good. But also, one of the things that a lot of moms don't really realize, because sometimes they come in just because they've got pain, they don't realize that the adjustments are really going to help baby to get into a good position as well. We want baby to be nestled right down in the pelvis, head down, ready for delivery. And chiropractic care has been shown to be really helpful to make sure that mom's pelvis is balanced so baby can get in the best possible position for birth.
That's giant because that could cause some discomfort.
Yeah, well, not just discomfort, a lot of times mom will say, "Oh, all the pain is on my right side. Baby's always sitting on the right side." Well, maybe it's because there is an imbalance within the pelvis. We correct that, and now baby can get themselves more centrally located. So it is, a lot of times it begins with the discomfort. Mom comes in because of that. But then they find out once we go through the education process, actually, that this is helping them hopefully go into labor and delivery with that an upper hand and having baby be in the best possible position. So that process is a little bit smoother.
Oh, that makes a lot of sense. So now especially as we're getting closer and closer to baby time, we're going to appointments all over town. You know, it seems like it's once a month, then it's once a week, then it's, you know, more frequent than that, depending on who you are and what you got going on. So how often typically do you see your prenatal clients? And I'm assuming that it might be different depending on their trimester or what's going on as well.
Absolutely. Yeah. So when I first start working with a mom, especially if I've been undergoing chiropractic care already, just kind of some maintenance care, we can continue that on that same maintenance schedule, whether it's, you know, every 2 weeks, every 3 weeks, because initially there's not a whole lot going on with mom's body shifting. You know, like the ligaments start to become, you know, a little bit more relaxed. So we start to see kind of maybe some of those issues. But a lot of times in the first trimester and partway through the second, we'll just kind of continue with some of that maintenance care. It's really when we get closer to that third trimester that usually I start to see moms weekly, just because baby's going through such a huge growth period during that time. And as baby's getting bigger, obviously the space constraint starts to come into play. Mom gets a little bit more uncomfortable. Maybe she's getting more swelling in her ankles. It's a little bit harder for her to put her, you know, clothes on in the morning because lifting her leg up is challenging. And so we start to see some of those issues. And of course, it depends on how active mom has been able to be during pregnancy. Is she working a desk job where she's sitting all day and doesn't have that movement? We might need to help them with exercises that they can, you know, get up and like stretch certain muscles, or use one of my favorite things to show is using just like a tennis ball to do some massage against the wall and some of the tight muscles. And so that's always something that we like to address and send moms home with things they can do, because that a lot of times helps them to feel and continue to feel better in between visits. So maybe if they don't have the time to come in as frequently as they would like, they have some tools that they can use at home, which is really essential in allowing them to feel better throughout the pregnancy.
I love that. And that was actually going to be my next question is, you know, what can a mom do in between visits with you to keep things, you know, moving in the right direction, keep things where they need to be and feel the best that they can? Do you have any particular examples of what common ailments moms deal with as their bodies are stretching and getting ready for delivery?
Yeah, I would say probably one of the most common things that I see is like a sciatica, like symptoms.
Yeah.
Moms will come in, I think it's maybe my sciatica. That's what Dr. Google told me, you know, and you know, it's that pain that kind of starts in your lower back or maybe in your hip and starts to travel down your leg. Sometimes it can be the pressure of baby, you know, like just putting some pressure right on that. Sometimes it's you know, it's a postural alteration, like sitting all the time can sometimes cause our pelvis to move and be in kind of a position that's not ideal. And so I would say sciatica is probably one of the most common. But another thing that I see a lot that moms don't really realize is your rib cage actually expands during pregnancy. Right. And so you've probably noticed that your bras don't fit anymore, right? And
Yeah.
you're like, I'm getting new bras or
Certain
whatever. And it's
jackets.
not, but it's
I'm
not
like,
just the cup
what?
size. Yeah, it's the actual band size around your ribs because your rib cage is expanding. And so I see moms with a lot of pain kind of between their shoulder blades, in their
Mm.
ribs, kind of even wrapping around in their torso. And then the other thing, headaches are unfortunately really common during pregnancy. Sometimes it's hormonal shifts. Sometimes it's, again, kind of those postural changes. And so really making sure that, you know, like we're supporting mom and not just those areas, you know, the pelvis where the baby's at, but also addressing those areas. And we can do some really gentle adjusting for that middle back area. We're not pushing down on the table. I can adjust that area all the way through till mom delivers. I have moms that are in all the way through all stages of pregnancy. And so that's another thing that a lot of times moms don't realize that chiropractic can really help with is that middle back soreness. And then of course the headaches too.
Yeah, yeah, I remember that for sure. Let's talk a little bit about nutrition. Now,
Mhm.
this is not something that I've ever heard another chiropractor talk about before. So I'm really excited to hear a bit from you what your advice is in terms of, you know, postpartum and prenatal.
Yeah, absolutely. So it's really important to make sure that you're nourishing your body with everything that you need and that baby needs. A lot of times moms don't realize baby's going to take what they need. from you. And so a lot of times what ends up happening is now mom's kind of depleted. She doesn't have the energy. Maybe she doesn't have enough of the nutrients that her body needs because she's growing that baby, right? And so making sure that she has a really good prenatal is important. I talk about that with my patients all the time. They're not all created equal if you look at labels. I remember even when I was first pregnant with my older son, I remember going into an OB and they gave me a sample and I turned it around and looked at it and it had like red food dye in it. And I'm like, why would I put this in my body right now?
Right,
You know, I mean,
right.
it's just, and it's because nutrition isn't really a focus of a lot of OB practices, which is fine, because in chiropractic school, we actually really dive into nutrition a lot more. And then I've gone kind of post-grad through a lot of nutritional programs. And so it is something that I talk about a lot with my patients. And so we like to make sure that mom's on a really good prenatal with, there are certain like active forms of the vitamins. Sometimes moms aren't good at something called methylation, which is taking something that's synthetically made and turning it into something our body can use. Folic acid is a great example. Folic acid is something that you see, oh, it's enriched with folic acid, but actually what we found is a lot of people can't actually absorb that. And so they need folate, which is the active form. So important. That's really important for the neurological development of baby. So that's something I always make sure mom is on. The other thing is like a DHA, which is in a lot of like the fish oil supplements. That again is really important for baby's neural development. So brain development, spinal development. And so if mom is taking that, baby's getting all that good stuff that they need. So that's really important. The third one that I suggest is more for mom's comfort. I don't know about you, but I hear all the time moms have like those night cramps, those Charlie horses that hit your legs, especially
Yes.
third trimester, really common, and they are insanely intense.
Oh,
And
I remember getting them
so
in my feet. Oh,
yes, yeah. I mean, it's really uncomfortable. And so there's some really nice things you like magnesium is a great mineral that you can take. Very safe during pregnancy. It's kind of like a natural muscle relaxant. So sometimes if mom's having trouble sleeping at night or they're having some of those Charlie horses, okay, let's try some magnesium or maybe just adding some minerals back into your water because we drink RO water all the time.
right.
And so mineralizing can help too. So just kind of some simple little things to add into their diet. A lot of times moms will have food aversions, especially the first trimester. So getting in some of that nutrition in other ways can be really helpful if they can tolerate it.
Yeah. I mean, it makes a lot of sense. You've got to put good things into your body in order for baby to thrive, in order for you to thrive, your brain to thrive, like all the things to do what they need to do. They need that support first, right?
Yeah.
So,
Well, and not just that, but postpartum, you know, mom is tired, mom, especially if mom's nursing,
mm,
if mom's not getting the nutrition that she needs, it's going to really affect her ability to be able to make milk and to provide, you know, nourishment for baby. And so I always postpartum, one of my first conversations is, are you getting enough calories? Are
mhm,
you feeding yourself enough? And almost always moms are like, probably not, right? Because
yeah.
tired, they're not thinking about cooking. And so I like to make suggestions, you know, like let's get some stuff for smoothies and have it available so you can make yourself a big smoothie and drink it while you're nursing baby. And, you know, stuff like that that gets kind of simple. So I'll talk towards the last few weeks of pregnancy about some food prep. Hey, let's get some stuff ready, right? Let's get some frozen fruit from, you know, the next time you go to Costco, get a big bag of something, throw it in the freezer. You know, get some bananas and just break them up, put them in the freezer, get your protein powder, whatever you like, you know, and kind of get ready to be able to nourish yourself in that way because it's so important for mom to get that nutrition after the fact. And all too often, I just see moms really not focusing on themselves because they're so focused on baby.
100%. And I feel even more so for new moms that have no idea what's about to hit them, because we really can't prepare ourselves enough. I feel like nobody could have told me enough for me to be fully prepared to truly understand how impactful that's going to be on my life, and on my time. And so I
Mhm.
think that it's giant. Freezer meals, yes, it's giant to set yourself up like that, especially as a new mom when you haven't been through it before, and it's really difficult for you because you haven't had the experience to understand how it's going to impact your life. That
Yeah.
was huge for me. My mom actually came and stayed with us for a month, and we would have starved if it wasn't for her. So pretty
Yeah.
grateful.
Yeah, that's awesome. Yeah. I mean, and if you have that help and accepting the help,
Yeah.
right? Because so many times, and I'm kind of categorizing us women, but we don't like to accept help. We're like, I got this, right?
Yeah.
And
I can do
so
it.
this is a time in your life where it's okay to take the help and say yes and just say thank you because no one's expecting anything back. It's just they want to help. And so just being appreciative and saying thank you is just it goes so far and you'll realize, wow, what would I have done had I not accepted that help?
Totally agree. So
Mhm.
now that we are on the subject of post baby, let's talk about chiropractic care for your newborn. Again, if you were sitting here talking with me and this was my very first newborn and I was talking with you about chiropractic care, I would be skeptical. I would be wondering, really, you're going to do that stuff to my newborn that you do to me? Like, I don't know about that.
And it's so common for me to have parents say that. And it's funny because I'll have, parents bring their kids in and they really don't know what to expect. And
Yeah.
so the first thing I say is, have you had chiropractic yourself? And if they say yes, I'm like, okay, well, it's nothing like that. It's absolutely nothing like that. When we take care of babies, I always tell parents, especially when they're infants, newborns, the first few months of life, it looks like I'm doing a massage more than anything. I'm being very strategic about feeling for movement within their pelvis. Birth itself, no matter how it happens, is a very traumatic thing for these little bodies, right? And
Yeah.
so we want to make sure that they have, enough movement within their spine. They don't have any muscle imbalances. Maybe baby's position in utero cause them to, have like a little bit of a head tilt because they just were stuck in mom's pelvis in a certain way. And so they come out and they tend to favor one side.
Mm,
Um, Another thing that I work a lot with is babies that are having trouble latching, and maybe mom's having a lot of discomfort. Nursing can be slightly uncomfortable at the beginning, but it should never be painful. And
right.
so, whenever I see, like moms be like, "Oh, it's normal. Breastfeeding hurts." No, it
Mm.
can be a little uncomfortable at the beginning, but it should never be painful. So something's going on. And a lot of times it's baby's mouth, maybe is a little bit tight. There can be some oral restrictions that we look for. There are great providers in the Valley. We're very fortunate here that can help with those situations. And if I find something, in my evaluation of baby that I'm concerned about, I have great places I can refer to where they can go ahead and help with some of those restrictions. And then I do the work on the jaw, making sure, can I help them to open their mouth a little bit wider? Can I work on their neck mobility so that they can nurse equally on side to side versus just always wanting to hit one side, right? And
Mm.
so the chiropractic itself, I always tell parents the amount of pressure that I use when I'm working on baby is about the amount of pressure that you would touch your eyeball with. So all of
Uh,
you contact lens wearers, there you go.
you know.
Yeah. Yeah, but it can really help. And then the other thing too is, if baby's gassy, if they're, quote, colicky, a
Yeah.
lot of times it's because baby's uncomfortable. And so that's one of the things that we can work with. And then we loop back around to mom's diet at that point too, because how are baby's poops? Is baby spitting up a lot? Is baby uncomfortable after they feed? Are they super gassy? Are they constipated? Like there's a lot of things that come into play with all that, but mom's diet can be part of it. And so always asking those questions, and I can make recommendations in that arena as well.
You are amazing. I love it. You're like a one-stop shop for mama and baby. It's perfect.
It's so much fun.
Yeah, I know. And I know because we know each other and I've been seeing you for quite some time now. Every time
Mhm.
I'm in your office, there's a big old pregnant mama in there or one that has just given birth. So I get to see all these cute babies. I get my baby fix when I go see Dr. Bobbie.
Yes. Yes. I know. Me too. That's how I get my baby fixed too.
Yeah,
It's so
right.
great.
Awesome. Is there anything else that you'd like to add for our mamas that we haven't talked about here?
Hmm. Um, well, I think, all the things that we mentioned, I think are just so important. I just don't want moms to think it's always about pain relief, right?
Mhm.
So chiropractic really is an awesome preventative treatment. And and I work with not just, like the provider, like the midwives, the doulas, the OBs, but also pelvic floor therapy is awesome. I'll refer to that a lot. So there's so many great resources. And so when you find someone who specializes in prenatal care, a lot of times we have a nice network that can really, and I'm happy to refer out to everybody, or I even refer to other providers like myself. If, I'm too far away, go see so-and-so. I know that they're great as well. And
Right.
there's a really good website. It's through the training that I took. It's the ICPA, the International Chiropractic Pediatric Association. They teach classes worldwide to chiropractors who want to work in this population. And so for anybody who's looking into chiropractic care while pregnant or for their babies, the website is ICPA4, the number 4kids.org. Or if you just Google ICPA, it'll probably come up, but there's a finder there where you can put your zip code in and you can find somebody who has all the same training that I do that's going to be able to provide awesome care for you and your family.
Oh, that's amazing. That's great information. What an awesome resource.
Yes, it's awesome.
If somebody would want to get in touch with you, come to your office, consult with you, ask you some questions, that sort of thing, what is the best way for them to do that?
So they can call my office. My phone number is 480-440-4511, or visit my website. It's bodywisechiro.net. And or if you just Google like prenatal chiropractic Tempe, I'm probably going to come up because I've been doing this in Tempe since 2008. And so I've had a lot of moms come in over those years. So I tend to come up with that search as well. So I'm always active in the MOMnation group. So, if you find my name, I'm Bobbie, kind of an interesting name, different name. So find me, and I'm always happy to answer any questions on a private message. If you have any, if you feel more comfortable reaching out to me that way, I'm happy to do that.
Awesome. Well, thank you again so much for spending your time with us. And guys, I can personally vouch, I do see Dr. Bobbie. I have for years. I love her and her office. So thank you so much for what you do to keep me healthy and to keep me feeling good. I really appreciate that.
Oh, yes, I love it. Thank you so much for having me on. This has been so great.
Yay, of course. Yes, you're so welcome. I'm sure we'll have you back because the topic of healthcare and keeping our mamas healthy and feeling good is something I'm so passionate about. So if you will have us, we would love to have you back sometime.
Oh, I would love to. That'd be great.
Awesome. All right, guys, if you want to check out any of our previous live and learns, you can hop on over to our YouTube channel. It is at MOMnation USA. That is the handle. Or if you prefer the podcast style, maybe you run a lot, bike a lot, hike a lot, then hop on over to your favorite podcast platform, do a quick search for MOMnation Talk Radio, and there you can connect with us and Dr. Bobbie. We will see you next time. All right. Bye-bye.